All right. Thank you so much for joining us this afternoon. Welcome to the University of Vermont's Master of Public Health webinar. We're so glad that you're here. We have a very full agenda. I will get through the panel introductions in just a moment. I just want to go over all of the things that we're trying to accomplish today. What is the Master of Public Health program here at University of Vermont, and what are the unique benefits of our program? We will hear from some students because we do believe that giving you that perspective is incredibly valuable to hear from students who have gone through our program. And then we're going to hear a little bit about what is happening in public health today. What are some of the controversies and why public health is one of the most sought after careers in the healthcare industry today. And a really unique aspect of UVM's public health program is our career coaching. We will chat with one of our advisors and our career coach, Heather Palo, who's joining us via webcam, as to the services that she offers and the benefit for our students. And then the career opportunities. I suspect we could spend an entire webinar just talking about career opportunities, so we will touch on some of the different opportunities for folks as they make their way through our Master of Public Health program. And of course, how do you get into the program? What are the logistics of the program? And what are the support that we have throughout the program to help you succeed? We'll go through those questions as well. Thank you very much for putting your locations. We always love to see where people are from. We really appreciate that. And now you're getting a little bit comfortable with that question box as well, the chat box. I will be monitoring those questions as to the best of my ability throughout the conversation, and we will hold a time at the end as well to capture your questions. So let's get started. We have a wonderful panel with us today. We have Jan Carney is with us, who is the Program Director and Associate Dean for Public Health and Health Policy and Senior Advisor to the Dean in the Robert Larner College of Medicine here at the University of Vermont. And we have Vicki Hart with us as well, and we'll learn a little bit more about her area of expertise, and she is one of the instructors in our Master of Public Health program. And we'll see an Epi mini module that she has created to give you a teaser of the kind of content that you could be absorbing and learning in our program as well. Vika Pleshkova is on my left as well, and she is the advisor and the enrollment coach here for our Master of Public Health students, and has been advising students for over 10 years, and we'll learn a little bit more about those services and the process to work with us as well. Heather Palo joins us from Washington. She is our career development coach, and she helps students in the program and then alumni of the program as well. So a very unique opportunity to be able to continue support for our students after they have graduated from our program. And my name is Nicola Willier-Fenton. I am the Content Marketing Manager here at the University of Vermont's Continuing and Distance Education program. So let's dive in. Jan, I want to start with you.
Sure.
I'm sure you get this question a lot. What is public health, and why is it something that we need to be paying so much attention to today? Why is it so important in our lives today to be mindful of public health?
Public health touches almost every aspect of our lives, and it's what we do together collectively as a society to ensure the conditions in which everyone can be healthy. So there's a lot to it. It's everything from connecting people to health care, to protecting the environment, to make sure people have transportation, and addressing some of the social conditions. So tons of examples, and we'll talk more about some of the ones that are foremost in the media right now and highly controversial.
And then how does that translate into our program? Because our program is interdisciplinary, and I think that's a really important aspect. It really creates a well-rounded person to be able to work in public health. Can you walk us through, and you see the slide here, what are some of the components of our program?
We want to make sure that everyone in our program has the strongest possible foundation. So you get all the core areas of public health. So you're ready to address and work in virtually any area of public health. And you have the epidemiology, and Dr. Hart is an epidemiologist, and biostatistics, and you learn about the environment and health policy, which can be one of the most controversial areas, and those social and behavioral factors that, as you know, tobacco use and e-cigarette use, and what we eat and how active we are critical behaviors that impact our health. Public health is about populations, and it's about prevention. So we give you all the knowledge and skills to help you be able to address all the current and forthcoming issues in public health.
And I know we get this question a lot in terms of, and students often contemplate online program, in-person program, and I've heard you speak many times about how you believe that an online program actually creates sometimes more flexible, a more innovative opportunity for our students. Can you touch on that a
Yeah,
little bit?
yeah, absolutely. Many of our students may be working in some healthcare or not yet in anything related to health, and they want to advance their education, but they need to fit it into their daily routine. And our program affords that flexibility. I would say that the faculty serve an online program as coaches. We are your expert coaches. But one of the things you get from that is the ability to teach yourself for your entire life, which is once you get your degree, you have to continue to teach yourself what you need to be current day to day. So I think those are a couple of the strengths, and I would ask Dr. Hart to comment on
Yeah, I'd love
Yeah.
to
on
add to
the
that.
unique strengths of that.
Yeah, I think one of the things that's really hit home with me this semester is I have the privilege of being a faculty mentor for two of our capstone teams. And these bring 5 or 6 students together to work on a project throughout an entire year. And one of the benefits of the online environment is you could have somebody just coming out of their undergrad degree working with a physician who's been practicing public health, working with someone who's been doing public health in the community for many years. So you really get a very diverse group of students that you wouldn't necessarily get in a classroom environment. And they can all learn from each other's perspectives and backgrounds.
And I think you touched on a really important piece too, the capstone project. There's a tangible piece of information that you create in a
Sure.
team. And so I do think that students grapple with, well, I might feel isolated in an online program, but this program in particular really tries to find the opportunities for students to work together in such an example of the capstone.
It really does. And we're doing more and more every course as we talk to students and we understand how important that connection is. Even in our core courses, we're migrating to discussion tools that are very social media based. Students really like being able to connect with each other. They can really learn about each other at the beginning of the curriculum, figure out where they have common interests, and build on that as they go towards their capstone experience.
One of the things in the slide that we have up right now is talking about the areas of excellence. And Dr. Carney, you talk about this a lot in terms of it isn't just one area that they will really excel in. And I like this visual because it really shows the cross section of the education and the opportunities that then they have as a result of our program. Can you explain why that's so important and why you structured the program in this way?
Because the areas in public health are connected. The real world issues, and we'll show you a couple examples to see some of the connections between the different kinds of skills you might need. The quantitative public health sciences, epidemiology, and biostatistics. And we really, to be in sort of a quantitative literacy mode throughout your career, and feel confident about that, really gives you a distinct advantage in terms of your career and your ability to advance in your career. Think that everything's hitched to something else. So it might be, you might have to do an epidemiologic investigation of an environmental health problem. So there you go. There's a couple things that are, might be connected. And in terms of the policy, when you look at health policies, you want to have the maximum leverage to improve the health of many, many people. So again, many of these skills intersect. And then we do live in a global society. And that is true for every disease that we might see now. Well, you might see that same disease worldwide, or you might want to travel someplace and experience all the different health systems and cultures and health challenges elsewhere. So we think that these areas will help strengthen your foundation and your career.
And I think that's a great segue into, we're going to show a short video. And then we're going to talk a little bit more. We're going to talk with Vika and we're going to talk with Heather Palo as well about and the support. But this video comes from one of our recent grads. Her name is Shirley Callahan, and she really touches upon some of the reasons why this program was so attractive for her.
It is multidisciplinary, and it was really hard to resist something that has law and economics and sociology and biostatistics and epidemiology. It was just a combination of everything that really interests me, as well as being accessible because it's online. Compared to other online programs, I felt maybe the size and because it was nearby could make a difference. But what I know now that I didn't know then is I would probably want to take UVM's public health degree even if I was in another state.
Hopefully that gave you a little bit of a perspective as to, and we have many more on our website, which you can find at learn.uv. Our health programs and specifically public health. We have other students talking about why they chose this program, and oftentimes they think about as an online environment, the right choice for them. And I think you'll hear many students explain how easy it was for them to integrate and feel a part of something a little bit bigger. So we'll get into that a little bit more, Vika, in just a moment. I want to come back to Dr. Carney for a moment because public health is kind of sexy too, and sometimes not in a great way, because there's a lot of things happening out there today that are really alarming and concerning as in society. And so how do you touch on some of those things to make sure the curriculum's relevant as well to what's happening?
Well, all of our professors and instructors are actively working to make sure that their course content is current. And if you look at any kind of media, social media, you can't help but notice a public health issue every day. And let me just give you a couple of examples of some that have just been, and they're not resolved yet. So we have the vaping and e-cigarettes, and this is from the CDC website. And with a growing number of young people and adults using e-cigarettes, and all of a sudden there were these serious lung diseases and deaths in healthy young people. And how do you start? Well, it requires creating definitions of that and using epidemiology, the disease detectives, and tracking that and trying to figure out, bottom line, what's causing it and how to prevent it. So this is something that has been, it's not over yet. And it's going to connect to, I think, how we develop policies that protect children and young people from potential harm. There's a regulatory aspect to this, but this is one of the most widespread and frightening issues that today we're dealing about. And then gun violence. And we know that there's so much controversy related to that. And particularly there's politics in that. And anytime we get into policy, we get into politics and we get into controversy. And there's tons of different opinions. And we're not interested in showing you one opinion, but showing you how to think about the science behind what we can do to prevent harm to public health through firearm injuries. So that's another current one that we are still grappling with in the United States. And then healthcare. Why is it so complicated? We rank very poorly compared to our peer countries about our ability to provide healthcare to all our citizens at an affordable cost. And we're struggling with this again. And I expect to see a number of new healthcare proposals coming in 2020 likely. And so we're trying to prepare our students to understand here in the U.S., other healthcare systems, and how do these health issues, public health issues, intersect with our healthcare system as we know it today and what we hope it will be in the future.
All with the goal of creating such strong students and candidates for career opportunities. So let's turn that direction for a moment. Heather, I want you to have your microphone turned on. I want to have you walk us through one of the unique aspects of our program is not only working with Vika to be able to map out what your plan is and what experience you have in your areas of interest, but throughout that process, as a current student and then as an alumni, Heather Palo steps in and guides you along your career goals and your aspirations as to what you want to do while you're in the program, coming out of the program, and then at various different points along your professional career. Heather, will you walk us through some of these points on here as to the opportunities that students have to work with you?
Sure. I also oftentimes speak with students in the beginning in our orientation sessions where we talk through what is involved in the orientation process to get you comfortable with online work and what are your career goals. Do you have career goals? What have you done in the past? What kind of skills are you looking for? How can we connect you with certain faculty? How can we connect you with people within the UVM community? How can we connect you in the College of Medicine? How can we get you engaged in in different internship and on-the-ground learning opportunities so that I understand where you're coming from and where your past is, and so that I can know where you're going and where you want to go, and do you have any ideas of what you want to do and where your interests are. And so we can connect you to the resources that are available, and if we have no idea where you want to go, or you have no idea who you're interested in, areas you're interested in, we can talk through some ideas, because some people say, I am so interested in public health, I just have 50,000 ideas and don't know where to go. And so some of that is just sort of talking through that and saying, okay, let's start with the bigger picture, and then let's narrow that down a little bit, and then narrow that down a little bit. So I can talk with students very briefly, or I can talk with students over time as they progress through the program. And then as we get closer to applied practicing experience, we have a course where we're talking through what an applied practice experience is. And so students actually get to do on the ground work where they live, in the location that they care about, in a project or activity that they're passionate about. So they get to apply some of this health activity and public health area that they're interested in different organizations. So it's an opportunity for them to do some on-the-ground type of work. And so I work with students from the very beginning in orientation all the way through toward graduation, and then, as you mentioned, as they become alumni. And so we're not actually just letting them go right away and saying, bye, have a good time, but also saying, as you become an alumni, where would you like to go next? What's a 1 year out? What's a 3 year out? What's a 5 year out plan? And again, some people have no idea what that looks like, or some people have a pretty solid understanding and want to know, what does that look like if they did a career shadowing of someone, or hey, I loved this person, how was their career path? And so I can connect alumni with current students and give them a chance to meet together or have a cup of coffee or get to know each other a little bit. And so the current students have an understanding of what alumni are doing, and alumni are able to say, if I was an alumni of 5 years ago, what does that look like? It's just an opportunity to connect all of our networks together, and so people are understanding what the world of public health looks like from the career perspective, and thinking through that a little bit. As you know, as the slide you just put up, there's so many different ways to be in the world of public health, and so sometimes that is also just a little bit baffling for students. And so depending on their background, they can come from so many different perspectives. So the career portion is a valuable part of our program, because the students are able to say, I'm in this step, I want to be in this step, and how can I get from A to B? And so between the faculty, the internship experiences, the on-the-ground activities that they're doing, they're able to get from one step A to step B and through our programming.
Great, thank you so much, Heather. I want to turn to you a little bit too, because in working with students in the beginning, in the enrollment process, and then advising throughout the process, I suspect you get this question a lot.
Yes.
How do you answer that for them? How do you guide them down that path so that they can make a decision as to what career they want to go to in public health?
Well, it helps that our program is a generalist program, so they get to experience different fields within the public health field. So they can take certain classes that are more interesting to them. For example, if a student is interested in epidemiology, then they can take more classes that are dealing with issues like investigating disease outbreaks, for example, or biostatistics too, that digs deeper into that. If the student has no experience in the healthcare, or if they're coming from fields outside of healthcare, we tell them that you don't have to have that background to enter the field of public health. And as they start taking those core courses and then getting into the electives, it might become clear to them what they would like to do. And also it helps when the time comes for them to do the culminating project experience.
Right.
When they can really hone in on the subject that they're interested in.
And do you talk to students too about the value of that project at the end, that there's something tangible that they can really bring to if they're looking for a job or looking for a career change? Do you think that's a valuable piece for students?
Yes, and I believe Heather touches upon that during the orientation. So we talk to the students about their final projects from the very beginning. I talk about it to a lot of prospective students, and then as they enter the program, they start getting ready right away. They start experimenting with the fields they want to go to, and also trying to find a possible place where they're going to do their applied practice experience.
And Vicki, I have a question too, and I
Yeah.
can see you want to say,
I
you
do.
want to add something to
I
that?
just
Yeah.
want to add
yeah.
one thing to
Yes,
what
please.
Heather was saying, to highlight another thing that she does for us, which is helping students build their LinkedIn profile.
Yes.
And I think we all know the value of building and having a network in the field in which you want to work. And having worked in public health and worked remotely in public health, having a strong LinkedIn connection, a strong LinkedIn profile can really be a great help there. And we have a UVM Public Health Network within LinkedIn where we can talk within the group, but also leaving the program with a strong profile is a really big boost.
Yeah, to continue on that
Yeah.
career path. I do want to make note for folks that if you do have questions, please, I'm keeping an eye on the chat box. So if there's something that you want to ask in particular to Dr. Hart or Dr. Carney or Vika or Heather, or the general question that I can kind of direct them, please do that. I'm keeping an eye on that chat box. I want to come back to career opportunities because I think that, and Heather and Vika and Heather, I suspect, gets this a lot too, is I think everybody wants to go and be a disease detective. It's like the hottest, because I think probably thanks to Hollywood and various different things, it seems incredibly fascinating.
Yeah.
But peeling back the layers, it is incredibly challenging work. I was reading an article in the Washington Post actually about the disease detectives trying to understand what was happening with vaping and what was causing this disease. And so the 16, 15-hour days that the scientists were putting in trying to figure out what was going on. So maybe pull back the curtain a little bit. What is it like, really, truly, to go into this field? It's probably not everything that Hollywood makes it out to be.
Not quite. So if you saw the movie Contagion, Kate Winslet made it look so sexy.
Yes.
A lot of it is behind a desk, looking through papers, searching through data, but it doesn't mean that it's not a sexy career option.
Yeah.
So you can work on so many different things. I've been an epidemiologist and biostatistician for the latter part of my career, and I've worked on so many different projects. It's fascinating, and it's so broad that you can really go in many different directions. So you can be an epidemiologist with a Department of Health, where you're looking at things in your community. You could be with the CDC, where you're looking at big issues like vaping and things that touch the national landscape. Here in Vermont, we looked a lot at the marijuana laws, so you can be investigating impact of those. Or as a statistician, you can be working on a number of different research projects, trying to figure out what risk factors are associated with what diseases. So there's just so many ways that you can go, but it is sometimes long days when things come up, especially if there's some kind of an outbreak. But it's fascinating, and it's absolutely, for myself as somebody who enjoys math and quantitative side of things and being a little bit of a data geek, it's absolutely the most rewarding way to apply those skills that I've found.
Thank you very much for that perspective. Dr. Carney, I want to ask you kind of a similar question from the former commissioner of the Department of Health here in Vermont. Seeing some of the different positions that are up on this slide today, has it changed? The kinds of positions and the kinds of things that you would have hired for when you were the commissioner?
I think that virtually all those are still on the list, and there's likely some more because the field keeps changing. And I think that, and as Dr. Hart was talking about epidemiology, the real life investigation of these diseases, people are getting sick. So you're trying to work really fast to figure it out and stop whatever the problem is, so that more people won't get sick. And here, I personally worked with our epidemiologists on preventing measles outbreaks and we had immunization clinics and Legionnaire's disease and finding the cause of what was happening to that. It was very frightening to people. So these are really important, and they're very time sensitive. They're often very public. It's very exciting work. It's also very important work. So it's not surprising that you might be working kind of hard sometimes when you're looking to take care of something that's really a problem. So tons of opportunities. That's just one, and they quickly spill over to, for example, if you were looking at an outbreak of Legionnaire's disease, you have to look at the environment, because the environment might be a cause of that. So all these things, again, are connected, and what we try to do is make sure that you have the strongest possible foundation that you are able to go ahead and pursue what you need to do in your career.
Yeah, absolutely. Thank you so much for that perspective. I want to. We have a few good questions
Yeah,
coming in too, and
that's
I want to toss this one over to Vika. Chloe asked, giving your best estimate, what percentage of the students in our program are working full time while taking classes?
I would say about 80% of our students
Wow.
work full-time. And if you're working full-time, I wouldn't recommend taking more than 2 courses per semester because these are rigorous graduate level courses, especially highly quantitative courses like epidemiology and biostatistics, so they will take up a lot of your time. Some students manage to take 3 courses at a time, but it's all about how well you can balance your life, work, family, and what other commitments you have. And some students decide that if this is what they want to pursue, some of the students chose to quit their current job so they can focus on their MPH work full-time, finish the program within 15 months, and then get employment within the field right after graduating.
And Carolyn kind of goes along those same lines with her question. Can you describe a typical timeline from the start of the program to graduation? And I know it varies, but you probably
Sure.
get that question a lot too, I would imagine.
Yes. So the good thing about this program is flexibility. So you can finish the program within 15 months. That is the fastest track that you can complete. Overall, you have 5 years to graduate, so you can really spread it out. We accept students every semester. You can do spring, fall, or summer start. You can take classes throughout the year, and 15 months typically gives them, if you're doing a very fast approach, then you will have to really load up on your courses. And that would probably require you to be a full-time student. If you are a part-time student, then it would say 2-3 courses per semester, then you can graduate within 2 or 3 years.
Great. Thank you so much.
And that's what most of the students
Yeah,
do.
yeah. I think most of the folks that we've talked to, that's kind of been their path. I have a question that came in from Rachel, and I'll toss this over to you, Vicki. Can you focus on epi without a science background?
Yes, absolutely.
Great.
One of the things I love about public health is that students come from all different backgrounds. So Vika can talk to this more specifically, but I believe we have a college math requirement to come into the program. So there's a little bit of basic math skill assumed, but we teach you what you need to know. You can come in, you can be in an epidemiology class, in a basic biostatistics class, and we teach you what you need to know for a public health career. You don't need to be doing advanced calculus in order to be a disease detective, but you do need to have some level of quantitative skills, and we can help you build those, whatever your background has been.
And kind of a follow-up to that, Jade asked, I was wondering how to be well prepared to become an epidemiologist through the program as well. How do you?
I love all these
Yeah, I know, right? We're so glad
epidemiologists.
you're here. How do you well prepare for this?
So having some kind of quantitative background is a good idea. So having some basic math and science skills. I think knowing, because epidemiology can be so broad, so knowing or having an idea of the area that you'd like to focus on is a good idea. You have a lot of students coming in, and it's just there's so much to learn and there's so much to become involved in. So if you have an idea of what you'd like to do as an epidemiologist, that's a great thing to think about too. It doesn't have to be set in stone, but it can give you some direction going into the class. So I'd say, yeah, just making sure that the basic math and science is solid, and then thinking about where you'd like to take this, because we can certainly, and with Heather's help, advance that throughout the course of the program.
And they don't have to decide that right off.
Right.
But one of the first courses students take is really a survey of public health, because you may not know everything that public health includes. And in epidemiology, you can investigate disease outbreaks, or you can involve in preventing chronic diseases like cancer and heart disease. So there's a lot to see, and we hopefully provide that experience for you right off.
Yeah, I want to add to that too. I think when we were talking about careers, we maybe glossed over a little bit the importance of having these quantitative skills to work on health policy.
Right.
So we need, as the healthcare process changes, our system changes, we're making different decisions about healthcare in the U.S. We need people who can take that data, and so we can create evidence-based decisions, data-driven decisions to make the best possible healthcare policy and systems. So there's a lot of different ways you can take this quantitative background.
Great. Thank you for that input. I really appreciate that. Here's an interesting question, and then we'll kind of move on to a few more course logistics. I'm trying to see who was asking that question. Jade was asking, are there jobs in public health that you can work from home?
Well, I was a remote consulting biostatistician from the Netherlands.
Yeah.
So I would say yes.
Yeah.
Public health it's a team sport. It's often very community driven. So it's not like you're a web designer where you can do 100% of your work from home. But I think if you can find a niche and you can evolve that within your community, there's possibility.
There's other opportunities. Great. So I do see other questions coming in, so I want to just move on a little bit, and then I'll circle back around to some of those questions. So I haven't forgot about you as well, Chloe. But let's toss back over to Vika for a minute. Walk us through. We have folks that are interested, and so what is that process like to get into the program?
Sure. So the application is fairly simple. We would like to see a college science and the math course on your transcript, just like Vicky said, because we want to make sure that you're prepared for highly quantitative courses like epidemiology and biostatistics. If your application looks great otherwise, but you're missing a lab science, for example, or a higher level statistics or math course, we may still admit you on condition, and then given that you do well in those quantitative courses, your condition will be removed. There's no GRE, there's no standardized testing required for the application. We're looking for a statement of purpose, which also will act as your writing sample, a resume, an application fee of $60, and official transcripts. If you do not have official transcripts, we will review your application with unofficial ones, but the Graduate College requires that at some point you submit the official ones. And then once the application is complete, we will review your application, and then the decision is made within 2 weeks, I would say.
And I know we just passed our application deadline for spring. If there's folks that are in here right now that are curious, would we still review some of them? Not too late. That's what I was hoping.
No, it is not too late.
Good.
It is not.
So if you're considering it and you want to start in the spring, let's see your application here pretty quick. But you see some of the other dates that are coming as well.
Yes.
Is there a particular time that more of the cohort tend to start? Is it?
I would say summer and fall. Fall tends to be our biggest one. But for the students who would like to finish within 15 months, I would recommend a spring or summer start. And the students don't have to wait until becoming an MPH student. So you can try out a course or two before you enroll in the program as a continuing and distance education student. And we will accept up to 9 credits of graduate level courses into the MPH program, given that you get a good grade. So that's another way to try out the field, see if you like it, if you want to really get into it, or if you missed the deadline. And the spring courses begin on January 13th.
That's perfect. Thank you, because that was Chloe's question.
Okay.
So thank you, Vika. Chloe, so there you go. Vika has advised a little bit about, yes, you can take a course or two to try things out before you actually get into the program. So let's keep going, just looking at some of the things here too, because maybe these will address some of the other questions that are popping up here too. We've these are the top questions you get almost every time, and I'm sure, Dan, you do as well, and Vicki too, of people considering when you're out in the community talking about this opportunity. So how long will the program take? We've talked about that, some of the tuition and financial assistance available. So let's unpack a little bit more of the online course. What, you get that question a lot?
Yes.
Yes.
So the online courses at UVM are, most of them are asynchronous, which means the work is done on your own time. You don't have to log in at a certain time, and Vicki and Dr. Carney can speak to that as well. You do have weekly modules when the course material and assignments are released, and then you complete the work on your own time. But of course, you have deadlines to submit paperwork and assignments. The courses are done through Blackboard, and we do have an orientation that it's about 2 weeks long before you start the program that will introduce you to the Blackboard. And the orientation will act as a mini course, so you walk through the modules, you will work closely with Heather, you'll go through Blackboard, you will have little assignments like introducing yourself to the rest of the group so that you get familiar and really comfortable with Blackboard.
I'm going to toss this question, the next one, over to Dr. Carney as well. Can folks have a concentration?
We have a generalist program, and within that you have 3 electives. All right. So if you are interested in environmental health, for example, you might take a couple electives in climate change, one in zoonoses or one health, and that would really, you have taken your electives all in one area. And students choose to do different things. They might say, well, I want to try one of each. I'm interested in all these things, and you can do that, or you can really focus. And and Vika can certainly, and our faculty can help advise you on that.
And one of the things too, going back to how successful can you be in an online course. And I think, Dr. Hart, you've really shown innovation and tried to really engage. What are some of the things that you do to keep those students engaged in an online course?
Well, it's really evolved over the course of the program and certainly over the course of my teaching. Some of the things that we try to do are to involve active learning principles. So these are ways that we can help students really be engaged and involved in their own learning. Some of the things that I've integrated in my course are video lectures, a little bit more engaging, exciting, a little bit more connection building than just a straight, reading something in a textbook or a voiceover PowerPoint type thing. We've developed or we've worked with continuing distance education to bring in social media platform discussion groups. So this looks a lot like your Facebook feed or Instagram feed, where it's much more colorful.
Yeah,
Students have an
dynamic.
opportunity to connect with each other, and it really promotes conversations as opposed to answering a question. And that's the kind of thing that we want in our courses, is building conversations and getting different ideas and allowing students to bring their own perspectives into the course. We have group work in a lot of our classes, which does mean that in an online environment, students need to be connecting with each other outside of the quote-unquote classroom. But it does allow students to connect and to start building their network and to connect with faculty in different ways as well. One thing that I think is really important that we do in a lot of our classes is different types of assessment techniques, because not everybody learns the same way, and not everybody enjoys being assessed the same way. So we have papers, we have quizzes, we have exams, we have discussion groups, we have all kinds of different assignments so that students can shine in the ways that are best for them.
Great, thank you so much for that perspective. And I have a slide up here too. Maybe you just walk us through, and I have a link that we will share this presentation out to everyone afterwards so that you can test this out. But what is this, what is a mini module?
So this mini module is something that we created because so many students were asking, what's it like to be a student in an online environment? What's it like to be in this MPH program? So what we have here is just 10 minutes that walks through an introduction to epidemiology. It could have been any subject. We chose epi. And it gives a flavor of what the lectures look like, some of the activities that might be involved. It's a couple of little quizzes to sort of test your epi knowledge. But it really gives students a taste of what it's like to learn epi and a taste of what it's like to learn it online in an MPH program.
Right.
So I really encourage interested students to take a look, because it's more of an active way to get involved in what it's like to be an online student.
Great, and such an interesting piece of information that we can share with folks to kind of whet your appetite, hopefully, for this program. I do have a few other questions that have come in, and this one ties back a little bit to the top questions that Vika gets. Internships, hands-on, how do folks get real-world experience as part of this, as a part of our program?
Do you want to talk
You want me?
about it?
Yeah, I'll talk a little bit about it. Well, one of the classes that you take this culminating project experience, and that's this group project, and it's designed, think of it like a capstone project, but it's a team, and this is sort of like how you would do such a project in the real world, so you get some practice doing that. Another piece of that is called the applied practice experience, and that's designed to help you learn to make your LinkedIn profile, and you will spend some time in an organization that's involved in public health of your choice.
Right.
And get some experience, do a little bit something for them, and so that you can really try out the place or the kind of environment you think you want to work. So that's built into the program. Some students volunteer in their local community. Some of our students are from here locally, many are not, and so you might look at either a health department, a community or not-for-profit organization, a healthcare community organization, different things that just volunteer, try out, look at the kind of environment where you feel like you will thrive with your public health education.
Great, thank you very much. Yeah, did you want
to
to add to that? Yeah.
There are some opportunities within the program to be involved too. We have a
Right.
number of different curriculum committees
Right.
within global environmental, quantitative, and health policy.
Yep.
And we have student representatives on each of those committees. So some of our students and alumni have become involved with the program itself. So helping us understand where we can make improvements and what would be great steps to take to keep the program moving forward. Some of our students are also TAs in our core courses. Some of our core courses are large enough that we need some instructor support, and students and alumni have been TAs for us as well. So there's opportunities to be in the
Yeah.
program as well.
And I know Heather works with students to find those opportunities for in their own communities as well. Dr. Hart, I want to throw this question back from Jade over to you. Does epidemiology also include mental issues such as ASD or some other disorders?
It certainly can. So epidemiology is the study of the cause and spread of disease. And disease can have many different, sometimes I think disease maybe isn't a good word, but
Right.
outcome
Yeah.
is. So,
Interesting.
and that could be a mental health outcome, physical health outcome, or it could be something like pregnancy, which we don't consider a disease, but is certainly an outcome we like to study. So yes, absolutely. We also have some different electives that Dr. Carney alluded to, like we just started last summer and we're offering it again this summer, a global mental health course, which is taught by Dr. Delaney, who's really been involved in suicide prevention and a lot of mental health issues within the Vermont community. So we really emphasize that piece of health as well.
We're going to wrap up here in just a few minutes, so I just want to make sure that folks, if they have other questions, that they're getting them in because we're about out of time. I did want to put in a quick little plug for some of the articles in our blog, which is on learn.uvm.edu. You will find student stories. You'll find their perspective. You'll find the types of experiences and the capstones and the various different things they worked on. You'll also find stories about our professors and about our faculty and the work that they're doing, which is so relevant to what you will be learning and what is happening out there in the world today. So I think we're all set on questions. I'm not seeing anything else come in. Maybe just one last parting thought from you, Dr. Carney. There's a variety of different programs out there. What makes this one so special?
I think it's the faculty and the students together.
Yeah.
I think that we work very hard to have the courses taught by faculty who are absolutely passionate about the field. And all of us just think this is the most exciting field that there is. And it really is. And then students, trying to involve our students in those conversations, working with each other to see those perspectives, which is really how you go out and apply your skills to help people. So I think that's really what we try to do.
Thank you so much. Thank you, Dr. Hart. Thank you, Dr. Carney, Vika, and Heather. And thank you, everyone who has joined us today. If you do have questions, please let us know. You'll see an email address there. And Kelly, thank you so much for putting in the link over to our public health programs if you want to dive in and see a little bit more about the program. As Vika had said, and Dr. Carney said, we are still accepting applications for spring. So please, if it's something you're interested in, we'd love to see your application. And we'd also love to see any questions that you have. Thank you so much for joining us. We will follow up with this recording afterwards. We hope you have a wonderful day.